stressed, it can lead to burnout, but with these three conditions, researchers say that these conditions are actually unavoidable, like they are gonna happen. And so what we need to do is just recognize it when it's happening and do something about it. And so let me give you some definitions here for what these conditions are. So vicarious traumatization. Now this is a more cognitive stress reaction, and this results from a shift in the belief system of the professional. So again, this is like a shift in the belief system of the professional when they're working with clients who have experienced trauma. So, for example, someone might be experiencing vicarious traumatization when maybe they're working with someone who got mugged while they're walking down the street. And then, the next time the professional is out walking down the street, they become paranoid that, oh my God, I'm gonna get mugged too because it happened to that person. But do you see the shift in the worldview that happened in that professional? One day they're walking on the street and it's fine, they're not so worried about stuff, and they work with a client who experienced something, and then it shifts their worldview, and the shift in the worldview there might be like, well, it's not safe to walk down the street anymore. But this can happen in a lot of different types of contexts too. It can happen in subtle ways, but in big ways too. So again, vicarious trauma, we're looking more at this cognitive stress reaction. Secondary traumatic stress, this is a more behavioral reaction. So the symptoms of secondary traumatic stress, they parallel PTSD. So this can look like a professional over-identifying with a client, becoming overwhelmed, feeling sort of encumbered by traumatic material. And this could also look like a professional just taking excessive responsibility for their client's life. So again, secondary traumatic stress, this is more behavioral. And then compassion fatigue. Compassion fatigue, this is an emotional and physical reaction it's just more cumulative over time. And the interesting thing about compassion fatigue, it's more caused by empathy than it is compassion. And so it's this fatigue that can develop over time when you're using empathy with clients, and you're just slowly starting to feel more and more tired or drained, and then it becomes harder to feel empathy or to use empathy as a therapeutic tool in your practice. So again, vicarious trauma, it is a more cognitive stress reaction. Secondary traumatic stress is more behavioral, and then compassion fatigue is more emotional and physical. Sometimes it can be hard to tell the difference between these three things, and I wouldn't get too caught up in saying, which one am I experiencing here? Because a lot of times things can overlap, and you can experience, one or two or all at the same time in different ways. So, with that in mind, take a deep breath in, gently exhale. And again, I know this is a lot of information to be taking in right now, but remember that being here and learning about this is self-care. So just a few other considerations for burnout before I talk about what to do about all this. Transference and countertransference. So this just means being aware of how your clients react to you and how you react to your clients. And this will happen in all kinds of ways, but when there are big reactions with transference and countertransference, this really does need to be addressed, because when this is not addressed, it can lead to the conditions we just talked about, and this can lead to burnout. But transference and countertransference are both there to give you very valuable information, especially if you're having a countertransference reaction to your client that's emotional. It's a signal that it's time to tap into those emotions and address it in some way. I highly recommend clinical supervision or therapy to try and work through things like transference and countertransference, because it can be so hard to make sense of this on your own. Also, the nature of the environment that you work in can be a huge contributing factor to burnout. And so in my self-care program, I have about 200 music therapists in my big self-care program. It's 31 CMTE credits, and the majority of the people in the program are music therapists. Of the music therapists that are in there, there's a very high percentage of music therapists working in hospice and music therapists working in trauma. So just something to keep in mind, that the nature of your environment could be very telling of what types of self-care you really need to implement to avoid burnout. And then, of course, there are your individual needs. And so we all come from different types of backgrounds. Your individual needs can depend on your age, your culture, again, any past trauma that you might have experienced yourself, anything you might be going on that might be going on in your personal life. In my self-care program, I also get a lot of music therapists coming in who are experiencing grief in addition to burnout. And so, when we're going through any type of life change, whether it's good or whether it's bad, this will influence our risks for burnout and the type of self-care that we need. So, with all of this in mind, what do we do about burnout? Now, my number one suggestion is to talk about it and to not go through this alone. So again, just by being here, you're already on the right track. If you're here in person or listening to the live stream, it means you are sort of in this conversation with burnout and being able to verbalize your experiences. I try to present at most music therapy conferences about this just to keep the conversation going. So again, we have this professional vocabulary so we can talk about burnout with each other. I also encourage you to approach your experiences with compassion. Burnout does not mean something's wrong with you, or that you're a bad person, or that you're incompetent, or that, everything's wrong. Burnout is a sign that compassion is needed for yourself. And, it can be so easy to be critical or judgmental of ourselves, but when we can replace that with compassion, then we can really start to move forward and listen to what burnout has to tell us. I also recommend continuing to educate yourself on self-care. So again, what we're doing here, but this is a lifelong process. So with self-care education, there's never like this end point. It's not like getting a music therapy degree where like you get your degree and you can use those credentials and, you sort of get to this point where you feel like you made it. But with self-care, we're not really trying to reach for that point of feeling like you made it. We're just continually working on progress, and education needs to happen throughout our lives because our lives are going to keep changing. And then obviously self-care, I'm going to talk more about that this afternoon. And then lastly here, listen to what burnout might be communicating to you. So everyone, take a deep breath in. Gently exhale. Now take a moment here with yourself. And I want to just bring you back to your self-care anchor number 1 of thank you for being here. So bring one hand to your chest. You can gently close your eyes just for about a minute. Thanking yourself for being here, but also just giving yourself a moment with all this information that was kind of just thrown at you. Just seeing how it landed in your heart or in your mind, knowing that there's no right or wrong reaction. And remember that just being here and listening to me talk is you doing something about it. Another deep breath in. As you exhale, you can gently open your eyes. All right, so let's bring this back to burnout as a messenger. And so, being able to listen to what burnout is trying to tell you, this can be difficult to do. It can definitely be hard to do on your own, and it can be hard to make sense of burnout on your own, and to think about what message burnout's trying to deliver to you. Sometimes there's all these blocks blocking like this message being delivered to either your heart or your mind so you can hear it. And that's why support is so important. But as individuals, what we can do in order to try and get this message delivered is to pay attention to your risk factors, pay attention to any symptoms of burnout. The symptoms of burnout hold so much information. And we also need to support each other. Sometimes it might not be like going to therapy and having this big insight, but it might be just talking to another colleague about what you're experiencing and then just feeling a little bit of a lift, enough so that, some type of insight might be able to come your way. And, this message from burnout, it might not be this like huge revelation, and burnout might not be asking for a huge change either. It's burnout doesn't necessarily mean you have to go change careers or get another job or like move far away. Sometimes burnout is just asking you to make a series of small changes, and then sometimes it's not always behavior too. Sometimes we think burnout's trying to tell us to change something we're doing, but it might be an internal shift too. Burnout might be telling you like, hey, can you just be a little nicer to me? Like, can you just talk nicer to me? You're really not being very nice to yourself in your own head. Or like, can you just let up on me, like just for today? These subtle internal shifts can be very significant. And, I wanted to share just a couple of messages that I've received from burnout in my career. And so part of why I'm standing here talking to you is because I've experienced burnout myself, and I've experienced burnout twice in my career. And actually, is this mic working? I'm tired of standing behind a podium. Check. And so I've experienced burnout twice in my career, and the first time I experienced burnout was very surprising because it was only 2 years into my music therapy career, and at the time I was working full-time at an inpatient psychiatric hospital on the trauma unit, and I loved my work. And it was that experience of loving my work but feeling extremely drained by it. And I was so confused because at the time I had this assumption that burnout happened to older people who are just like over it in their career. Like they're just tired, ready to retire or whatever, and just tired of working for so long. And so it never even occurred to me that I was experiencing burnout. And like what Joy was saying earlier, the research is saying that new professionals are at highest risk for burnout. And we are losing a lot of new professionals in the field. And in my music therapy programs, I'm getting a lot of new professionals in, some of them just 6 months out of their internship where they're already experiencing burnout. Now, the good thing is they are recognizing it as burnout, like not like me. It took me a while to figure it out. And for me, my burnout was so extreme. I quit my job and I saved up a bunch of money to kind of just get myself grounded and get to know myself again. And when I did, I got a message from burnout, and my first message from burnout said, start a private practice. And that was surprising to me. I did not see that coming. I never really saw myself as a business owner, but I needed more freedom as a music therapist than what I had when I was employed. And so I did. I started a private practice. It slowly grew. I still run this practice in California. And so my private practice was specializing in addictions and trauma treatment. And so my private practice did give me a lot more freedom than what I had when I was employed. However, that freedom wasn't exactly what I thought it was going to be. I thought, I'm my own boss now, and I can do whatever I want and take a vacation and not have to ask anyone for permission. But, it also meant I was a lot more isolated than I was when I was employed and working, in inpatient care. And that got tiring really fast. and I didn't have those people to just interact with every day. When I was doing my contract work, I was, usually the only music therapist there. It was a lot of advocacy work, a lot of driving, and I found myself getting burnt out again. Just a few years into my private practice, I thought, oh no. And those feelings started coming up, like, if I can't do this, like maybe I'm really not even cut out to be a music therapist. And that thought triggered all these professional insecurities for me of just not being good enough. And then it translated to I'm not good enough in my clinical work and all this. And so when I sat with myself, and at this time I was in clinical supervision, in therapy, and being able to work through this experience, the second message I got from burnout was to go back to school. And so I did. I went and I got my master's at St. Mary of the Woods College. This gave me a community of music therapists. I was a part of a very strong cohort who I loved and adored. We communicated every day, so it gave me back that connection to other music therapists. And this opened the doors for me to research what I had been experiencing. So when it came time to write my thesis, I wrote my thesis on burnout and self-care in the music therapy profession. And I dug through all the literature, and it was so incredibly validating for me that wow, this information is out there. I didn't know about it. This is why I was experiencing what I was experiencing. This is how I can avoid it. But I thought, why didn't I know about this earlier? So writing my thesis, it was so cathartic for me. And then, of course, a thesis is a lot of work. So I thought, I didn't want it to just sit in a library after I graduated. And I thought, I really want to share this information too. And I thought, how can I do that? So I self-published my thesis as an ebook. It's called Resilience Over Burnout, a self-care guide for music therapists. Now, it's an ebook because it comes with a workbook to help you formulate a self-care plan, but most of all, it summarizes all the research that's out there in music therapy and in related fields. And, when I completed this, at the end of it, I just really felt like this is what I wish someone had given me when I was a student, or when I was an intern, or when I was in music therapy, a new music therapy professional. And so I released this ebook a few years ago, and it got a good response. It's now a required text in some undergraduate and graduate music therapy programs. And at the time when I released the ebook, I was still running my private practice. But when this ebook got released, I started getting a lot of calls and emails from other music therapists looking for clinical supervision or needing help with self-care. And so at the time, I thought, okay, well, I guess I'm the person to do this. And I had been doing clinical supervision for a while. But then I found music therapists were sort of looking to me not specifically for supervision, but they really wanted to focus in on self-care. So I just called it self-care coaching. And so I started coaching music therapists on self-care. And, slowly my private practice started shifting from my music therapy clients to my clientele now being mostly music therapists. And that was such an interesting shift. And I loved it, when it was happening. It made me so happy and excited. But, soon enough, my schedule started to become full. I'm not going to burn out, trying to help people with self-care. So I was like, okay, I don't want to overload myself, but what should I do? So as a solution to that, I created my self-care program. Now, this is for me, this is also for the clients I was working with, because I found a lot of the clients, my music therapy clients who were experiencing burnout, were also experiencing isolation. They wanted to connect with others, and I found myself repeating myself to them, in these different types of coaching calls, because there were so many similar themes. And so I thought, what if I could just get them all together and coach everyone, with social support too, and have more of a community rather this being one-on-one. And the things that I keep repeating myself, what if I just recorded it and so people can listen to it on their own time and re-listen to it when they need to. So this became my self-care program, and This is a very long program. It's 31 CMTE credits. I'm going to talk more about this program at the end of the day, but what's important to me is that you know that this exists. Because again, a lot of what I've created here is what I wish existed when I was experiencing burnout or when I was a new professional. And all of this led me to founding the Self-Care Institute, where this is the majority of my work now. I do keep a very small private practice in LA just because I like to have at least part of my time still in clinical work because that's so fulfilling to me. But now the majority of my work is focused here on the clients in my program and supporting other professionals with self-care. So that's my story. Again, I mainly wanted to tell that to you because the two messages I got from burnout, again, were start a private practice, go back to school, but it doesn't necessarily have to be these big messages either. I've also gotten other messages like, go easy on yourself, or, give yourself a break, or like it's okay. I've also got other messages to, go out and travel, like have fun and enjoy life. And so I'm really excited that we're going to take a little bit of a break. In 15 minutes, we'll have our panel discussion on professional experiences with burnout, self-care, and stress. So, deep breath in, exhale. Thank you for listening to all this information about burnout. I will have time for questions later on in the day. So if you do have a question right now, you can write it down and ask me later. But let's take a little bit of a break now till 10:30.
All right. Just a reminder, restroom facilities are off to your left, my right. Get some fresh air. There is some coffee, water, tea, fruit, and goodies in the back. Thank you. Marissa Bell. Suzanne. Yeah, no, of course. We forgot to do water bottles. We normally do. All right, where's Suzanne? And Marissa Bell. Yes.
Leave that where it is.
All right, we are going to get started, so I'm going to ask you to get back to your seats, please. All right. Welcome back. Everyone. All right, we are going to get started with our panel discussion. We are very fortunate to have quite the diverse panel of experts who have been asked just to be their authentic self throughout this conversation. So let me take a moment just to introduce them. I think you all know Ami at this point, but for our live stream or people who have just joined us, she's the founder of the Self-Care Institute, which provides therapeutic support for professionals around the world who are experiencing burnout. And she's also the author of Resilience Over Burnout, a self-care guide for music therapists, and the creator and facilitator of Resilience Over Burnout, a self-care program that allows for 31 continuing music therapy education credits. So please put your hands together for Ami again. Sitting next to Ami is Marissa Diaz Falcone, who was born and raised in Puerto Rico and a Berkeley music therapy alumni who works as a music therapist at Mass General Hospital under the Catherine A. Gallagher Integrative Therapies Program, providing individual and group music therapy services on the inpatient and outpatient pediatric and adult units such as oncology, hematology, and psychiatric care, among others. Please put your hands together for Marissa Bell. Next to Marissa Bell is Dr. Suzanne Hanser, the Chair Emerita and Professor of Music Therapy at Berklee College of Music, and the past president of the World Federation of Music Therapy and the National Association for Music Therapy. Please put your hands together for Dr. Hanser. Next to Dr. Hanser is Jocelyn Koh, a board-certified music therapist originally from Malaysia, who came to the United States to pursue her education at Berklee after reading about the profession in Jodi Picoult's book, Sing You Home. She did her internship at Care Dimensions, a hospice organization in the North Shore, and is currently a music therapist at the South Shore Conservatory, a community school for the arts. Please put your hands together for Jocelyn. Next to Jocelyn is Professor Adrienne Flight, an assistant professor and practicum supervisor at Berklee. She also serves on the advisory board of the Berklee Institute for the Arts Education of Special Needs and is the president of the New England Region Association of Music Therapy. Please put your hands together for Adrienne. And our last panelist is Letitia Brundage, a master's candidate in music therapy at St. Mary of the Woods, and an internship director and the lead music therapist at Roman Music Therapy Services in Massachusetts. Please put your hands together for Letitia. And now I'm going to step off and let the magic happen.
All right, so my hope for this panel was really for us just to have a conversation about burnout prevention, about self-care. Burnout can show up in so many different ways, and it can help to hear other people's stories or observations about burnout. It can also help to hear about burnout from people other than me. So I'm so grateful that all of you are here with me today. Thank you so much just for your time and energy, but also for your expertise. Each one of you has just a different skill set and knowledge to bring here. And so what I thought we'd start this conversation out with is, how burnout can show up in different ways in our lives, and to just get some real-life examples of what burnout can look like for music therapists. And, these examples can help us build a framework of how to better recognize or address or treat burnout. And so, I want to ask you, what does burnout and stress look like for you in different parts of your career? Or what does burnout prevention look like for you? So, Letitia, maybe we can start with you. And just
Seriously. Thank you. Whew. So my experience of burnout happened similar to Ami at the very beginning, near the beginning of my year. So when we're in school, right, we have all of these supports kind of set up in place. We have multiple professors, we have supervisors, we have all of these places that we can go to for the support, and it's kind of intrinsically built into our education system, which is amazing and so awesome. So as soon as you kind of get, or at least my experience, when I graduated, finished internship, got board certified, and got my first job, I was suddenly on my own. For me, decided, I'm from the Boston area, but I went to school at West and then returned here to pursue my career. And so I didn't have the same kind of network that maybe some of you are building right now in your undergrad of being from the Boston area and staying in the Boston area. And what happened, I was an independent contractor for an education collaborative, and I was very isolated. I was very alone, not only from having regular colleagues, because I was working at 7 different schools, just traveling throughout the day, throughout the week by myself. And I got very burnt out very quickly. And what my message that I got from being burnt out was that I needed a community and I needed support. So I ended up taking a year off and actually had my first child, took a year off with him, and when I returned, I knew that whatever position I took was going to be with other music therapists. And I needed at least one other person on the team that knew what I was doing and knew what I was talking about, so that you can talk to someone without advocating all the time, right? You need that genuine understanding of what you're doing and where you're going. And so that's why I found Roman Music Therapy Services, and I've been there since. And really just finding that community of support and supervision. Okay.
Adrian, what about you?
Sure. Hi. I've had a couple of experiences with burnout so far. There's still more time, but so far in my career, and like you, they happened near the beginning. I also am not from here, and I didn't sort of come into a professional job where I had a really strong network of people, and that's isolating. And due to, I think, what were economic factors that sort of determined how I spent my days at work, and social factors, the social programming around the clients that I was serving, it demanded a lot. And it turned into compassion fatigue, and that led to burnout. 2 things that I think are really important are, you mentioned supervision, and there's different kinds of supervision. One is your supervisor at work, who may or may not be a music therapist, but who is ultimately watching your job performance. And then there's supervision where you can really be honest and say, I'm having a hard time. This is too much, or this is how I feel in response to this. And those are 2 very different things. And finding an outside supervisor, for me, it wasn't a music therapist. It was actually a social worker who's a saxophonist. Just had this really beautiful balance of clinical thought and appreciation for music that allowed me to kind of get through that. And the other thing, kind of to jump right into it, I think that's so important that helped me is my own personal therapy. It's so valuable. All of this work brings up a lot of stuff, and that's okay. It's going to bring up a lot of stuff. So take the time to, carve out time to commit to yourself and say, okay, I'm gonna be there for my clients, and part of what that means is taking time to be there for myself as well. So that's for your own personal therapy and also taking care of your physical person as well.
Jocelyn, what about you?
Hi, I'm a new professional. I just got board certified a couple of years ago, and thank you. And I just had a very recent experience with burnout, and it's been going well. It's been accumulating. so I did my internship in hospice, which is a lot of individual, one-on-one kind of work. And then I took a job out in community school, which is a lot of group work. And that transition for me was pretty tricky. I was very lucky to have really supportive colleagues, but I also needed something more. And I think the message that the burnout that has given me was to diversify my coping skills and to really allow myself to be be able to communicate with kids in an authentic way, which was hard because in hospice I work with a lot of older adults. And so I took up improv comedy class, which allowed me to be silly with other people. And that really helped me with kids. I love working with kids now, so that's diversifying coping skills was one of the burnout messages for me.
Oh, I love that. I love the improv comedy that you took up. Yeah. When I was a new professional, I was experiencing burnout. That's when I started playing open mics. Just sort of something different, like have a different relationship with music, and then like you get to the mic and you're all scared and nervous, but it felt so good to feel that again, of like feeling alive. Yeah. Thanks for sharing that. Yeah. Suzanne.
All right, so I experienced burnout before there was burnout. So literally, and I know this is hard to believe, but I've been a music therapist for 48 years. I know, I don't look that old. I'm not. I started as a child. And so literally, I was practicing before 1974 when burnout became a thing. And I was, throughout my career, I've experienced so many of the factors that you talked about, Ami, and so many of the different emotions, and so much of this. And I hope I've learned something from each of these experiences. And I guess I've throughout my career, even as I was hearing about burnout, I got into it. Oh, that's what I have. It's so reassuring to label it and to know that others are going through it. But you know what? That wasn't helpful. It put me in a victim mentality. And I got to ally with my colleagues who were likewise burned out. And that was not a healthy community. And so it really switched my perspective to think about experiencing burnout, however it was. And I'm thinking of a time when I was at the VA and I just hated the job and I hated so much about it. And I had such a hard time and I felt very disrespected, not just as a music therapist, but as a person. And I decided to, what I call, go above the line, which is that instead of being a victim and instead of aligning myself with others who didn't like our supervisor and didn't like the conditions of the VA, and, frankly, just having a lot of bitch sessions, right? I wanted to take responsibility. What was I doing that I wasn't getting respect? And I realized, you know what? I'm not that confident about my work. I wanted to take control of the situation, and I wanted to do it above the line. That's a term in conscious leadership, where you're open and you're curious and you're approaching things in a positive way, not just looking at the symptoms. Now, I wasn't denying burnout. I was not denying the feelings and the real stuff that was happening. It was very distressing and really causing me to want to make a radical change. But that radical change is often quitting, going in a whole new direction. And I didn't want to do that. I felt like there was something for me to learn here. And when I twisted my thinking in that way to learn something from this awful experience, I did a very curious thing. I did a paradoxical thing. I worked more at the VA. So what I did was, briefly, is that I had worked in another unit at the VA that I really liked, and they said, we'd love for you to come back 3 hours a week. So I worked more at the VA, but I worked in the area where I was passionate, where I felt respected, and it reminded me of what I had to offer. And then I found I was a better professional when I went to the unit that I really disliked.
Yeah, I love that. And that's a good reminder that sometimes work can be self-care too. It doesn't have to be separate things, but how you work can be self-care in a way to nourish your soul and find that alignment. Thank you. Yeah, so Marissa Bell.
So for me, just like Jocelyn, we actually took class together. I don't think I'm a brand new professional as well, and I don't think I've felt that I've been burnt out. And it might be, as I analyze this for myself, it might be because where I work, I did my internship, and I also did my practicum. And before that, I shadowed the facility. And so since that moment, I fell in love with MGH, and I knew that, boom, this is what I want to do. I was very passionate that medical settings was where I wanted to work at. And so at MGH, I have supervision from my boss, Lori, and how Adrian was saying, that's a huge thing that helps me stay healthy and value the work that I do, and also because people know what music therapy is. All the other healthcare professionals have a good idea of what it is. So for me, I kind of felt a little bit of burnt out when I was studying music therapy at Berkeley, and it might have been, the course load and a little bit of it during my internship, but it was more tied because I was working as an RA at that time, and I was done being an RA. So that, at moments when I was going into my internship, I felt like, oh, wow, I'm so tired, and my focus wasn't where it needed to be. So that's maybe where I kind of felt a little bit burnt out, and it tied over to my work. But since my internship, I've been, focusing on exercising, going to acupuncture, seeing a therapist. All those little things have really helped me continue doing the work and continue to love the work that I do.
Yeah, and that's a good point. Burnout can happen as a student or as an intern, too. These things don't have to, you have to wait to feel that to be when you're a professional, but to notice it at different times during our careers. Yeah, thanks for pointing that out. So sort of on this topic of burnout, especially, with music therapists, our relationship to music is so sacred, and, it does change, sometimes in bad ways or good ways, but, when music does start to become our work or becomes our study or whatever we're doing in our internship, like for me, I found my relationship to music changed the first day of my music theory class. You hear it differently. It's a different relationship. And, when it becomes work, when it starts to become something you're paid for, too, that becomes, this entity in your space with your client, it changes. But I would love to hear any experiences of your own changes in your relationship with music, how that's looked over time, and how do you maintain a healthy relationship with music? If any of you care to address that.
I can start, actually. So my principal instrument is violin. That's what I auditioned for at Berkeley, and at the end of my Berkeley time, I was not really loving my instrument that much. And so I was very happy to hear that within the medical setting, I wasn't, going to be playing violin. And I loved playing guitar. So that was awesome. And actually during my internship, I met this patient that her dream had always been to learn how to play violin. And I was like, oh, great. Here, of course this is happening. But that was a moment where I had lost a lot, my connection with the violin that I had started learning since I was 4, I completely lost that connection that I had with it. And so it was through that patient experience of someone that was so, she was going through cancer, very at the end of stage of cancer, and this is all that, brought joy for her, part of what brought joy for her, and I was able to provide that for her, and that was the most gratifying and memorable experience. So for me, that was just a very eye-opening experience. And then in terms of music as, doing it at home, how you mentioned not just doing it in the clinical setting. I've learned to appreciate to learn songs, not just for my patients, but songs that I also want to learn for myself. And that has helped me move forward.
Thank you.
Several of you know I have a relationship with my piano, and it's like any other relationship. It's definitely love-hate. And I took a sabbatical, more than a sabbatical, from the piano. I just didn't want to play piano for a long time. I can't even count how long that was. And then when I came back to it, I realized the love. There's something about being trained to listen to the form and the timbre and all of the critical elements that we learn, and it changes the way we listen to music and experience music. And piano was such a technical language for me. And then I learned to improvise, and I had the hardest time with that. But it enabled me to make mistakes at the piano, which I never could do. So improvisation and using improvisation in my work, lightening up by using the piano then in my work, enabled me to kind of lighten the whole thing up. Even when I went back to my classical pieces, and I realized that I was coming home from work and going to the piano, but it was an escape. I didn't want to think about work. I didn't want to deal with what I was going through on that day. And so I escaped into the piano, and I felt much better. That wasn't really helping me in the long run. But when I came home and I specifically went to the piano to express what was going on for me, and to give me an outlet, and to give me the therapy, the music therapy, as I was practicing it with others, to enable me to love the piano again. It really worked well for me.
Yeah, I love that example. And I made up this term. It's called pseudo self-care. So there's a difference between self-care and expressing, and pseudo self-care where you think you're doing something good, but it's avoidance. Yes. Yeah, that's such a good example of that. Yeah, and that can happen in music. That can happen with Netflix or, ice cream or, yeah.
Yeah, I think I have a couple ways of maintaining relationships with music. One is to learn a new instrument, so learning bass, which I haven't really played before. It was really fun. It's also visiting my ever-changing relationship with music, and really reflecting on it. So when I was growing up, it's always been an emotional outlet for me. And then when I went to school, I really liked the intellectual part. I liked theory. I liked all the theory that comes with it. And then when I work in hospice, it became more spiritual. And I think for me, realizing that different ever-changing relationship and tapping on each period of my life when I listen to music really helped flourishes my relationship with music.
Nice, thank you.
For me, giving myself permission to let my relationship with music evolve changed the way that I experienced it. So, also a pianist, and you do have a complicated relationship with your own instrument. So knowing that I could walk away from it for a little while, and for a while I'd maybe play the guitar or something, or take voice lessons. And sometimes what I would choose to listen to, for example, in my own receptive music choices, would be close to something that if I happen to overlap in musical taste with a client, that's okay. And maybe I would go the other way and listen to something completely different. But giving yourself permission and space to kind of allow that to happen, and that does require a shift away from sort of a really narrow thinking in terms of expectations that we grow up with. And you talked about perfection in your instrument or your craft. So it's a shift in the way that we view it and ourselves. Mm-hmm.
Yeah, and I like that word you use, is giving yourself permission. Yeah, for things to change.
For me, very similar to Jocelyn, my early relationship with music was as an emotional outlet, as my own coping mechanism, very much why I found music therapy in the first place, is how I use music for myself. Over the years, I found that my relationship does evolve and change quite a bit. And one thing that I realized for myself is that I really can't listen to music in between sessions during the day. If I've discovered that it really just overstimulates me and it distracts me. It doesn't allow me to just sit with whatever just happened and just process it as I go from session to session. Not everyone's a community-based music therapist, but I do spend a lot of time in the car, so I do get that time. I took a course a couple semesters ago in my graduate studies where we had homework assignments, where we had to use improvisation with ourselves. He's taken that course. And I rediscovered a different relationship with music for myself, was allowing myself to be vulnerable again with music and to very much connect with whatever was going on through my musical expression and exploring that. And that has been tremendously helpful. And it's something that I actually advocate for. With my interns, I definitely say, no, just play music for you and express yourself and explore what's going on outside of prepping for sessions and learning that rep and all that jazz.
And Letitia, so you're an internship director, and you're very knowledgeable about the internship experience. How do you think we can better support interns in that, because it's such a critical part of someone's journey in music therapy, and either support them with either self-care practices or burnout or their relationship with music, but so either what do you see that interns need support with, and how can we better support them?
One thing that I always do is I always have a conversation at the beginning of internship about self-care and what they do for self-care. And if they don't have anything that they do, then we try to develop some coping mechanisms that they can utilize. And also just periodic check-ins. There are kind of these stages that happen throughout internship that are kind of consistent, and there are moments of freaking out that kind of happen. Because it is hard, it is stressful, it's a lot of work, you do feel a lot of pressure. At the same time as being rewarding and wonderful and a tremendous time of growth. But really emphasizing that they're taking time for themselves and engaging in those self-care practices.
Yeah, nice. I like that you asked them right away. Yeah, it's a great question. Yeah, thank you.
Mm-hmm.
And, now on this topic of, burnout prevention and developing resilience, what thoughts do you have on this? And I know, Suzanne, you have a lot of expertise to share on just developing.
A lot of years.
Yeah. What can you share with us?
Thank you, Ami. Goodness, I think that we have within us the knowledge that we need to care for ourselves. We often, there are just too many excuses, especially during a time like internship, right? And self-care can become another burden. And so it isn't, to me, it isn't like self-care is the answer, but it's the awareness that that I need something different. I need to make a change, as you pointed out so well this morning. It's about perhaps not just saying, oh yeah, I need to go to the gym more, or I need to practice more, or I need to breathe more. but it's more about the realization, and sometimes making a radical shift. So my co-author of Manage Stress and Pain Through Music, Dr. Susie Mandel, says, don't burn out, fire up. And I love that. You can quote her. Mandel, M-A-N-D-E-L. Please quote her. Isn't it great? It's like burnout, when you have that angst, that energy, that distress, how can you channel that in a positive way, in a realistic, authentic way, to be honest about the number of hours in the day. And maybe it's about just taking a breath and acknowledging this is a hard job. I signed up for a really tough one where I'm in the bottom of the hierarchy in healthcare and in education, and it's a tough job. There's no question about it. So when do I need to make a little shift, as you suggested, to just tweak something to care for myself? And when do I need radical change? And I think that that's a kind of important point in one's emotional experience of burnout.
Yeah, absolutely. Yeah. Anyone else? Thoughts on developing resilience, burnout prevention for music therapists in general?
I really like what you said about don't burn out, fire up. I definitely, for me, burnout is very physical energy inside me. It just stays there, and if I don't spend it, it will really like accumulate and rot from inside. So for me, I actually make it a point to be disciplined and exercise to spend that energy, just get it out of me. I think that was what I really resonated with, yeah.
Something else that comes to mind is if you have a connection to another art form, being sure to, it's so hard to say, do it, find the time to do it, but it can be really powerful because you don't listen in the same way to a different art form because it's not music. And that can just be like less of a stressor because you use it differently. And the other thing is remembering your reach, remembering what you're there to do, and that you can't fix the world, you can't fix everything, but you can do these 3 things or these 5 things, and write them somewhere so that you can see them. Check them off a list if you need to get certain things done, so that you are seeing your accomplishments and not overwhelmed by the enormity of the things that you're aware of that have to be done.
You just reminded me, my boss always says whenever we get feedback, she's like, okay, print it out and frame it and hang it up somewhere. So we don't often get feedback for the work that we do on a day-to-day basis, but sometimes we do get those little snippets that stay with you. So I do kind of have like a collection of these little moments over the years that I will look at from time to time to kind of rejuvenate myself. And also the other thing that I participate in a lot is supervision of different modalities. And most recently, I've rediscovered using the arts in supervision. And not just music, but multimodal arts, like you said, exploring different modalities and looking at clinical situations in different ways, and also personal growth in different ways, right? As we grow as clinicians, we're not just growing as a clinician, we can't leave our personal selves out of it as well. So bringing that all into supervision and with peers, I think, like you said, there's a difference between having supervision with your boss and having supervision with those that feel more on an equal level with you and what you can get out of that.
Yeah, I love that idea of framing your feedback and really celebrating it, because it can be so easy to forget sometimes. And actually there's a term called vicarious resilience. And so we talked about vicarious trauma, being traumatized by someone else's trauma, but vicarious resilience can be finding resilience in other people's resilience. So when we're working with someone who's experienced trauma, or working with someone who's survived trauma, who's strong enough to come to us for help, who has actually demonstrated a tremendous amount of courage and strength. And when we can tap into that, we can also feel their courage and gain some strength from them, and we can practice that ourselves intentionally. We do have a great session, or when we get good feedback, to make sure we remember that, because sometimes it's like it's that negativity bias where a bad thing will just nag at you in your mind, even though there's 10 other things and everyone's telling you you're great. It's that one thing that'll sort of eat at you. And so, to celebrate and just really remember your accomplishments and your feedback is so important. Yeah.
May I comment?
Yeah.
I think that you're reminding me that it's so important to remember why we got into this field, the passion we feel for the field, when the everyday just brings us down. And it's all about attitude and approach, and that's something we can change. We can't change so many of the factors that you listed up there, so many of the things that cause burnout, and yet it's the way we look at those things and the way we look at our day, the way we approach our work that can cause that kind of shift.
Yeah, for sure.
I was gonna say for me it's such a huge thing, and when I am done with my work day, I like to reflect and think about, well, what was like a really, really good moment of the day, and maybe a moment that I didn't feel so great about, and just simmering on that and just reflecting on that, it really helps. But as you said, seeing what patients are going through and seeing the impact that music therapy can have on them, that gives myself so much energy, and it feels good to see that they're being impacted in a good way.
Yeah, that's beautiful.
Yeah, Marisabel, to add to that simmering on things that didn't go too well, a little mantra I like to give myself is, I work with the most information I have at that moment. And yeah, that's helpful.
So when I took Suzanne's class a couple years ago, she worked on helping us take away the saying I should have, and you talked about that as well, and don't should on yourself. Yeah, and that has stuck with me since then, and it really works. I can get so stuck on being like, oh, I should have done that, I should have played that chord right, I know how to play that chord, all those little things that it's the perfectionism that I have always, that I want to be perfect, and no, that's not the case. But yeah, don't shit on yourself.
And don't shoot on others.
Another kind of alluding to this, shifting your perspective when you're going back in, is every challenge being an opportunity to learn and grow, right? So just because it didn't go so well this time, you have more knowledge on how to approach it next time, and to let yourself make mistakes, because it happens on a daily basis, right? We all make mistakes, and it's okay. It's part of being human.
So I do have other questions, but I do want to open it up here. Does anyone in the audience have any questions for our panel that you'd like to ask? Yes.
I think given the statistics that you brought about the new professionals really experiencing burnout, and I wonder how we can really more concretely bring that down into the student intern level so that we can prevent or even just bring more awareness to it. So any recommendations of things that you feel like we could do more of for the students and interns that are out there?
I'll speak to this a little bit. Right, I'm doing my thesis on supervision right now, and one thing, I've read a few different articles on graduate cohorts doing peer supervision throughout graduate work and into their first, like 5 years or so of work, and how that has really helped them develop resilience and prevent burnout, and to feel supported. So perhaps encouraging peers to get together might be a way to help prevent that from happening. Just finding a community and not being scared, and encouraging, that openness to reach out, because we all feel that, like, that pressure, that new professional pressure, I can do this, and I'm gonna be fine, and I'm gonna get through it. And so really, rather than muscling your way through it, which is what can lead to early burnout, I think, is going into your professional career with that continuation of support, be it from peers, your internship supervisors, folks, and not being afraid to reach out.
Yeah, that's the peer support is so critical, and yet I have seen where peer support can become that bitch session, where we're just wallowing, and it feels so good that others can relate and empathize with us, and we want that empathy so badly. It's really hard to break out of that and move to the other side of it and say, can we use this support in a constructive way? What can we do together to make conditions better, or to advocate for ourselves, or whatever the group can do better? And the other thing is that while peer support is wonderful because you have so much in common, I'm really such a fan of mentorship. I look at mentors throughout my career, people who really helped me to move through whatever transitions, and there are always transitions, and whatever life brings you. And I recall particularly being a mother of 3 children and trying to balance work, and didn't know too many people who had the kinds of demands that I put on myself. So mentors, people who have been through it, can be such a good thing. In fact, I'll put this out there. I've been talking to my colleagues about starting Mentors Are Us, I'm serious, an online kind of support network. I love your ideas in this room, and whoever's watching virtually. Yeah, help me to create an environment for people where there's safe to let out your fears and your concerns. It's the fears, right, that lead to so much of the bad stuff that happens. It's really about fear and staying above it and saying, okay, what can I be open to and curious about? How can I make positive change? Very different attitude.
Yeah. Anyone else want to address the question? It's a really good question of... Oh, we have one more?
I just wanted to add as a resource petition for your thesis, and Suzanne for Mentors Are Us. I'm a member of a.m.Add.
I'm going to stop you for 1 second because...
Thank you. So as a resource in terms of this mentorship and a peer support, Mass Music Educators has a program called Embracing the New Music Educator. And it's been in place now for, I don't know, probably 10 years. And it's both mentorship and peer support. And it's proactive as opposed to just sitting around complaining about the issues that are happening. And it's a really nice model that's out there. And that mentorship then just continues on. And the support that the new teachers feel is huge. And I think that has a huge place for us as well. But there's a nice model here in Massachusetts anyways that exists, so.
You're welcome.
Any other thoughts of how we can support students or interns so that the new professionals can not be so much at risk for burnout?
So can I ask a question?
Yeah.
Or I don't know if it's a question or I don't know what it is.
You can just say it.
So one of the things that a couple of you have mentioned is our relationship with music. And I think it's something that we see all the time. And I know I've personally had many struggles with my music. And in that, many of us get into music because music provides something for us, whether it's a social connection, a sense of mastery, an emotional outlet. And then when we go to music school, it's totally different, right? And it's a struggle because it's part of our identity, but then we're also being judged on that identity, and it becomes this thing that is really love-hate. But then we are also losing a part of ourself. And then which doesn't help anything, right? And then as music therapists, we're giving music. And Letitia, even your words about, you can't listen to music in the car because you just need a break from the music. And Suzanne, I was hearing what you were saying, how, we're so often, we have to come home. And I see this a lot with our students and our interns, and I do internship supervision with our students. And it's this, I have to go home and I practice. And we're getting more and more and more removed from our music. And then we also have that struggle with, and I'll bring up Marissa Bell, with our primary instrument, and how, part of going to music school is we're supposed to have mastery of our primary instrument, how do we have time to master that while we're learning other instruments that we're going to be using on a daily basis? We have, going in and out. And, Suzanne, I just started playing piano and guitar again for me. And it's so funny because when it came time to choose music that I wanted to play, I couldn't even think of a song that I wanted to play for me because I'm so used to, oh, well, I should learn this song, I should learn that song. Or I played all the music that I used to play, but I don't want to play it. And so it's hard to, so I guess it's not more of a question and observation. I don't even know what it is, reflection. But my question becomes is how do we, as a profession, do self-care with music when it's such a, and we've separated our music self? I don't know. I'm done rambling now. Fix it.
Well, I actually teach an online class where a lot of there aren't any music therapists in the class, but there are a lot of musicians who take the class. It's called Music Therapy Techniques for Wellness. And I think the best thing that I do in the class is to teach people how to have a different relationship with their music. And it evolves in a supportive community where people understand each other. And that reflection is so important. All that I ask them to do is to keep a music journal and to listen to certain pieces of music, their own choices, my choices, listen for this, listen for that, and I kind of are teaching things that they know, how to really listen to music, meaning how to listen to music and listen to the response that you have to the music. And it seems to shift things. We just got to shake it up a little. We just got to shift our perspectives on music. And for some it takes a different instrument, and for some it takes being reminded, and some, it's something different for each of us. But if we reflect on that, I think we all come up with our answer.
And I think it's kind of like what you're saying, Adrian, about things evolving and giving it permission to change or not look the same as it used to be before. Sometimes we get so attached to how our love for music used to be and wanting to get that back, but letting it to turn into something else. But I like to look at our relationship with music is a love relationship. It's almost like a marriage where it needs energy and it needs some attention and it needs space to grow too. And it's a lifelong relationship that we can have, and it can become love-hate. You can get into arguments with it, but that's part of the growing process too.
To add on, as someone who really uses music as an emotional outlet, I find that, like I mentioned earlier, diversifying my coping skills and taking improv comedy lessons really gives me that creative outlet. So when I do revisit music again, it's so fresh, it's so new. So that's really exciting that learning new skills, I found that to be really helpful for me. Yeah.
So oftentimes when I work with patients, maybe let's say above the age of 10, I have a set of questions that we usually ask them. And one of the questions is, what type of music do you like to listen to? Or if you had one playlist that you can only listen to, what songs or artists would be on that playlist? And I get a response from patients, but one time this little girl asked me what type of music. As soon as I asked her that, she was like, well, what type of music do you like to listen? And I went blank. I had not revisited, well, what were my music interests at that point of this was maybe just starting as a brand new professional. And I decided, I was like, okay, I don't have Spotify, so I'm going to download Spotify. And Spotify has been a great form of me getting to know new music, which is a little bit more of my preference. So whatever is out on the radio is what I like. But yeah, it just took me that moment of oh wow, yeah, I haven't really been thinking about what music I like to listen to that serves a special purpose in my life. And oftentimes it's when I'm exercising or when I'm in the car driving, that I listen to music. I never do it in between sessions or anything like that because it can totally be like overstimulating sometimes. So yeah.
Yeah, I just got Spotify this year too. I love it because I used to use Pandora a lot or radio, and like you just turn on whatever music comes on. But Spotify, I just feel like it's a little bit more intentional. And it's a great way to like learn or hear new music that they somehow know they'll like it.
And they even have playlist based on like have a good day playlist.
Yeah. Mhm.
And they upload new music. And another thing that I wanted to mention is also that a bunch of your peers here at Berkeley are creating music. And that's another way that I've reconnected with my joy with music is listening to the music that my peers are coming out with.
Yeah.
So.
Yeah, that's an important one for me too, or like hearing other people's music and having music played for me. Because then it balances out that relationship where it's not just music coming from me going out to everybody, but people can play for me too. And now it's my turn to feel good and listen. Yeah.
So I'm wondering if anybody has any tips for creating boundaries for yourself in taking your work home with you and like into your home relationships or romantic relationships, etc.
So I will cover, just to say, I will cover the topic of boundaries in the afternoon, but it's a big word, but this is a really good question of how do you guys do that?
Well, I just want to play off of what you were saying about a client asking you what kind of music you like and how much of a boundary that is for me. And there's like all of a sudden this, so much pressure, and what song do I pick? Do I pick a song? And do I pick a song that they're ever gonna be able to, that they're gonna know? Or do I pick one that's so obscure that they'll have hopefully no idea what it is? I think there's that boundary of like what music is for me and what music I bring to sessions. And not saying that you, like especially in improvisational sessions, obviously you're gonna bring your authentic self in all of your sessions. But there is a difference between how I am in a session with music and how I am in my personal life with music. Another thing that I do, just as far as like documentation and things like that, setting boundaries, is that I never do documentation at home. I learned that a long time ago, is that it doesn't matter if I have to stop at a Starbucks on the way home or something like that. Just getting it done outside of my home space allows me to be present in my home life.
Okay, so unplugging is really important for me. There are apps for that. There are apps that turn off your phone at certain times. There's an app for everything. But that's really indicative, isn't it, of our dependence on this technology and are constantly being connected to everything. So that drives me really crazy. And I used to make appointments to go home. And, I've had 3 kids. I was a single mom when I came here. And I just had to turn off. And so I'd make this appointment, and I would do whatever I could on my way home to prepare myself and to really focus. And I think the whole overused idea of mindfulness is important there. It's about awareness, and it's about being aware that these worries and thoughts are coming into your head from the day. And are you reacting to them? How are you reacting? Because, of course, you're going to react to these uncomfortable emotions. But if we become aware of what's happening, that's really helpful. So I recall one time, and I just worked with a young man who was dying. And I came home to my children, and my first inclination was, I'm so blessed to have these wonderful, healthy children. And the second thing was I became so impatient when they said, I don't want to eat this, and I have too much homework, and, no, I don't want to wear that coat, whatever it was. And it was like, how dare you? And I we react. I thought I was handling it so well and positively, but we have to bring awareness. We have to stop and say, well, what's going on? Am I intruding on my time? Am I intruding on my family time? Am I intruding with my emotions on other people? Don't shit on them.
So to go off what Suzanne said, I agree, awareness. And then something else that's really helpful is ritual. So knowing that at the end of the day, you're going to, however you get home, this is what you're going to do on your way. You might need silence. You might need to listen to your own music. I always change whatever I'm wearing. I change my clothes. And that is such a small thing. It takes me a minute. My clothes are probably dirty anyway. I spend a lot of time sitting on the floor with kids, so they often need to change. But that is helpful for me. And it's like the shedding of the skin and then the new immediately. And I find it to be a really significant way for me to manage that.
Okay. Hi. I was wondering. There are many forms of therapy, and we can discuss about which one is more valid or not. But I guess it's safe to assume that pretty much all therapists need some form of personal therapy. So I was wondering, what are your thoughts about seeing especially for music therapists, to see maybe a music therapist or an expressive arts therapist, opposed to see maybe a traditional therapist, a psychologist, or other forms of therapy. What do you think works best, and what are your experiences? Thank you.
Well, I think one thing to remember is that the type of therapy that's gonna be most beneficial to you is gonna be as unique as the person you are, and regardless of the practice that the therapist you seek out, I think the right fit, the relationship, just as in our work, not every client gets along with every therapist and vice versa. So I think being patient with yourself, if you try out one person and it doesn't work out, it's okay. It doesn't mean that therapy's not going to work for you. It doesn't mean that type of therapy is not going to work for you, but to be patient and seek someone else out.
Yeah, what I recommend is experimentation and seeing, what does work for you. And it does really vary on your individual needs, the therapist's own personality. Throughout my own life, I've tried a lot of different things. And, being a music therapist in music therapy, it is such a valuable experience to be on the client's end of that. Sometimes I found for myself personally, it was hard to turn off that therapist mind because I knew what she was doing. And we were also work in a small field, so it's difficult to avoid a dual relationship, which brings another element into it too. So if I'm, sometimes seeing some type of other creative arts therapies, or I don't really necessarily know the philosophy behind what they're doing, it frees me up a little bit. But, I have experienced music therapy sessions or music therapy-based supervision that worked really well at the time. I've also been in talk therapy sessions that also worked really well at the time. And, I think it's about finding the right fit for you at that particular point in your life. Because even what works now might change later. But that is a really good question in, looking at the different therapies that are available and trying it out and seeing. I think that's usually the best way, is to just get a little bit of experience. Yeah. So we're almost out of time. We have one more question.
So this might be kind of a loaded question, but I find that as a music therapist, my undergrad degree was in performance, and I've been writing songs since I was in elementary school, and I've made my own music before, and it's out there. How do you maintain that relationship with music as a performer without like especially since I work in the mental health field in a partial program, there are a lot of patients out there that would probably recognize me if I were performing. So, thoughts?
Great question. My initial thought is that you can give yourself some permission to make that okay. That what if they did see you out in public singing your own songs that are really personal? They might, they might learn things about you maybe you don't really want them to know, but they'll also see you as your human self. And it's almost like, the way I kind of think of it, it's like, I think this is a common problem celebrities have. So you can think, oh, now I'm a celebrity and I have celebrity type problems to deal with, where it's like a problem, but it's something you can approach from your own angle too. And again, this can take some experimentation. I wouldn't let it stop you from like performing your own songs or just being mindful of what that process looks like, not letting it stop you, but just observing your own points of discomfort, but letting yourself experiment and say, okay, I'm gonna go out and perform. And even if you are doing a performance, you can imagine, what if a client was here? Would that be okay? And you can find these own boundaries within yourself too. These boundaries aren't dictated by like the laws of the universe. A lot of this is up to you, and sometimes discovering that for yourself comes through experience. But actually, we will be working on, I'm going to do a self-care experiential in a little bit, and I think this will help you a lot, where we'll be dialoguing with music. And sometimes I think even in your situation, maybe it's hard to, like your question felt like a loaded question because maybe it's not just about you. It's about music and what's okay with music, and we're not really sure what that is, but we can build some communication with music so you can decide together what's appropriate for you. And so we'll work on that today. Well, that's a great question. Thanks for asking. And so just to wrap up here, I have one final question. What words of advice or encouragement, if you had something just brief to say to a music therapist who is experiencing burnout right now, what words of encouragement or advice would you give them?
I just say stop, listen, and fire up.
Self-care is completely about you.
Don't ignore it. It's not going to go away.
You are not alone. There are many people experiencing this, so reach out.
I was just going to say, embrace it for a little bit and then work on it.
Thank you. How about a hand for our panelists?
Thank you.
All right, so we have some gifts. Now, everyone in the audience, you can get out your self-care anchors sheet out that you're continuing. I think we're on number 3. So your self-care anchor number 3 is, what is your biggest takeaway from this panel discussion? What was your biggest takeaway from this past hour? And you can write that down for yourself.
Thank you again, panel. We're going to get ready to shift into an experiential for self-care, which I'm super excited about. I hope you are too, so don't go anywhere. You can come down, but our panelists may leave the stage.
All right, so again, get down your anchor number 3, your biggest takeaway from the panel discussion.
And then we'll start our experiential in just about a minute. All right, so once you've got this down, I'd like you to please take out another sheet of paper, or just start with another blank sheet of paper. And we're gonna get into our self-care experiential before lunch. And this is gonna be a writing exercise, so you'll need just a blank page and something to write with. So get a blank page, something to write with. And then everyone, please take a deep breath in. Slowly exhale. And bring it back to that anchor number 1 of thank you for being here, thanking yourself. And so this, this topic of our relationship with music is a big one, and I want to help you develop that here today. And so take a moment here just to sit with yourself. Bring to mind the word music. And just observe what your relationship with music is like right now. There's no right or wrong. Remember, our relationships have their ups and their downs. Just seeing where it is right now. And in this moment, I'd like you to think about if you could say something to music, what would you say? And just think about it. You don't have to write anything down yet. And so for our self-care experience for today, what you're going to be doing is writing a letter to music. So you can open your eyes if your eyes are closed. And on your blank page, you're going to dialogue with music. You're going to write a letter saying, "Dear music," and it's going to end with love from, or you can close the letter any way you want, from your name. Now in the middle there, you can write whatever you want to. Here are some ideas in case you need some prompting. You can thank music for something. You can share any concerns if you need to make amends or say sorry to music for whatever reason. If you have any ideas you want to share with music, you can ask music for help, and you can tell music anything you want to. So we're going to take about just 5 to 7 minutes here. Now I'm creating kind of a tight time boundary here, just because this could really go on forever, and we're not looking for like a page or like pages or books, but we want to sort of condense your message to music into what you really want to say right now. So take some time, speak to music. There's no right and there's no wrong here. Take your time. If you have any questions, I'll be right here and you can let me know. Yeah. What's that? Oh, yeah. Oh, before this. Okay, so before this, so your self-care anchor. Oh, I was just saying, just get in touch with music and say, do you have anything to say with me? Okay. Yeah, really. Okay. to take about 1 more minute. All right, so start to close your letter, knowing that, if you need more time to finish this later, you can finish this later, but we can work with what you have so far. And now what I'd like you to do is, can everyone please stand up? And then once you've stood up, can everyone please find a partner? So partner up. So partner up. Raise your hand if you need a partner. There's 2 people over. If you don't have a partner, I will be your partner. All right, so partners have found each other. Okay. So, in your partnership, you're going to have, let's see, the person closest to this side of the room is going to be the music ambassador. Now, all of us here are ambassadors of music. You are a music therapist or student or intern or whatever. We are here at Berklee College of Music. Everyone here is an ambassador of music in your own way. Now you're going to stand in your position of being an ambassador of music, and you're going to listen to your partner's letter. Now, very important here is I didn't bring any of you here to work. You're not here as music therapists, so you're not here to be doing music therapy with your client, your partner. So here's what it's going to look like. The ambassador of music is going to say, I'm an ambassador of music. I'm here to listen to you. Your partner will read their letter out loud, and then you'll simply say, thank you for sharing. I hear you. You don't have to give any feedback or, again, you don't have to go into that therapy role. Just listen and then switch roles. So get started whenever you're ready. Yep, switch whenever you're ready. Yes, absolutely. So you're going to read your letters? Raise your hand if you need more time. Keep going. Take a couple more minutes, but make sure you've switched if you haven't switched already. All right, so when you're done, you can get back to your self-care anchors. Your self-care anchor number 4 is I can communicate with music. And I also want to address if this exercise was difficult for you at all. Sometimes writing that letter to music, maybe if it doesn't go so smoothly or it's hard to find the communication. No need to freak out about that. Sometimes music doesn't want to communicate in a letter. Maybe it wants to communicate in its own language or in some other way. And so there's lots of ways to communicate with music. This is one of them, though, is to speak directly to it in a letter. So this is your anchor number 4. And your anchor number 5 was grounding. And so we started our day with our grounding meditation. And the grounding meditation we started with, I was actually reading from a script. If you'd like that script, I have it for you. And let's see. You can sign up here. I have a email sign up available, so you'll get the grounding meditation recording of me talking. You'll get the script that I wrote, so you're welcome to modify that. You can use it for yourself. You can use this in your practice. You will also get the presentation slides also. Yeah. So something to keep in mind, you can sign up now or during lunch. If you don't have a smartphone at the moment, I do have sign-up sheets here. And so before we close, for lunch, how was this exercise for you? Any feedback or experiences with sharing, either writing your letter or sharing it with your partner or being the music ambassador? Yeah.
Writing the letter, I really enjoyed it because oftentimes, especially being a student learning music, you don't have a chance to, you appreciate it, but you don't give it as much recognition in your life as you either did before or would like to.
Mm-hmm.
So this kind of put me in a space where I can be grounded and just keep working on music because it is such a huge part of me, but also speaking to someone, it puts you in a very vulnerable place.
Yes.
So that was kind of nerve-wracking, but I'm like, I would love to share what music is to me because that's why I'm doing what I'm doing.
Mm-hmm.
So, and I'd love to write more. Like, she was just saying, well, I really want to write more. I was like, I feel like I would write a novel because it's my whole life. So this is definitely something that I want to continue to add to. So I'm done.
Remind everyone, because we're doing live stream, please use the mic.
That's right. We need to speak into the mics.
I just turned on number 1 up there. Thanks.
Thank you for sharing. And it's like, yeah, this dialogue could go on, and this could also be a very good journal prompt sometimes when you're writing in your journal. That's also a sacred space where you can speak to music. And you mentioned a good word, and it's recognition and recognizing music. And sometimes you can feel music recognizing you back. Yeah, thanks for sharing.
Well, being on the other side as beginning the music ambassador part of it, I know we weren't supposed to give feedback, and I didn't, but like this is my feedback now. Um, you know, it's just very beautiful to see how, most of us here are musicians, like that's why we're here. And hearing someone else's perspective that goes so close to yours, sharing that was something I found not only intimate but beautiful, because music is a very powerful, like, connection, like the vibe that you create, not only with a friend, with a client, with anyone that's around you. Like music just has this one particular element to it that will make you bond even more, even if you don't choose or intend to do so. So just seeing the other person's perspective and just saying like, hey, I feel that way too. Wow, that made me realize I feel that way as well. Like it just opened up a lot of other areas where I was like, wait, I didn't see music that way. Now I do, or is like subconsciously I did, but I didn't recognize it until now. So it was a very beautiful exercise.
Yeah. Did someone else have their hands up? Yes. Thank you for sharing.
Short and sweet. Basically, for me, it was very clarifying. I had to confront my denial. So it was really, really good about the conflict, about how you just kind of go, oh, I don't want to think about that right now. I don't want to think about the fact I'm not doing anything for me. I don't want to think about that. But now I went, oh, now I have to talk to music, and they have to tell me what they really think. So thank you. That was really good. So now I can just not have to think about it like that.
You're welcome. And then there's something about, saying something out loud to another person who's hearing it, but then that sometimes can take off at least the denial part of it, because then it's out there in the world. Anyone else have any comments before we close?
So for me, it was when you started explaining the activity, I was like, oh no, here we go. This is gonna be a hard one. Like I know, I feel it. And I just started thinking, and my head just couldn't stop saying thank you, thank you, thank you, thank you, thank you, thank you. And I was, well, I guess I'm just gonna start writing thank you, and then whatever is just gonna come out. But then I discovered that my relationship with music is not actually what I thought it was. And it's there. I just didn't. It was like someone on the panel said just like allowing yourself and like sit on it. And it's just I thought it was a bad relationship, but I just realized that it's a good relationship. But I was not validating that and just kind of like going like, oh, burnout, I must be burnout. And like it's kind of like a requirement to have a hard relationship with music, and it's actually like not. And I just and everything just flow out of that, like realization.
Nice, nice. Lori, thank you for sharing.
I had a really, I loved the process of it, first of all. So thank you for giving us that space to really talk to music like that. And I think for me, as a vocalist who's always been able to sing, it's just been like my breath ever since I, can remember. I never had to practice. I could just do it, and it was pure expression of my soul. And then you try to pick up an instrument, and it's like so painful to then not have that. So it was a good opportunity to be able to recognize that music is this part of me that I don't ever have to think about. And then I got to say, and I'm sorry that the challenges with trying to translate that to another instrument has taken me farther away from you. So it was just nice to be able to look at both of those.
Yeah, thank you.
It was definitely helpful, like you said that it might be. Kind of realizing actually that my relationship with music is like an old friend who I
only run into sometimes on my lunch break, but don't actually call and get coffee with. And that was really helpful.
Yeah.
So it's like, got to nourish that and actually make time to hang out.
Yeah.
So
I
thank
like
you.
that metaphor. Yeah. All right. So this afternoon we'll be covering self-care. We'll kind of lighten things up in the afternoon. So again, before you leave for lunch, you can sign up here. You can sign up on your phone or computer. If you don't have one, you can sign up on my sign-up sheets here. And then we'll take an hour break for lunch, and then I'll see you at 1 o'clock.
So I'm just going to quickly say, we're going to put that sign-up sheet up on the table right out here, or you can use the online. I am going to ask everyone, please acknowledge Ami, who's been doing a fabulous job. And I'm sure many of you have questions and want to talk with her more, but I'm going to ask that we all respect her hour lunch break right now and let her have that to herself because it can be overwhelming to be up here all day. So if we could just all respect that. And she will have time this afternoon for some questions and answers. And like I said, lunch is available. It's on your own. The Prudential's right here. There's the cafeteria on 160 Mass Ave, which is about 4 blocks. It was not raining last time I checked, so I do encourage you to try to get some fresh air and a quick brisk walk. And we'll see, we start at 1:15, so if you could be back here by 1:10, that would be fabulous. Have fun.